We are here at Day 4 Arab Health, M42 our main stage, and we've really been spoiled with our speakers, with international acclaim, celebrating wonderful Emirati talent based here in the UAE, as you heard from Dr. Nala there, and wonderful international collaboration and partners. And this is really at the heart of the UAE's success. And here at M42, we are happy to support this, to bring together all of this expertise here on this stage, M42 at the nexus of technology, sustainability and health. And I said that word there, technology, and that's what we're really going to be focusing on here in this particular session. We are very privileged to be joined by not just one, but 3 speakers from the National Reference Laboratory. And I'm going to introduce them all to you one by one and ask them to please take a seat underneath their names. To begin with, Dr. Layla Abdul Warath, who is the CEO of the National Reference Laboratory. Dr. Shweta Narang, who is the Medical Director and Director of Clinical Operations. And Dr. Andrew Turner, the Technical Director. Ladies and gentlemen, I said that we are spoiled by the quality of our speakers here today. And, you know, it tickles me to decide who should I begin with first, because I think we need to set the scene for our wonderful audience. They've been super enthusiastic, and I know they've been super interactive. Please have your questions ready. I will be sharing my panelists with you very soon. But first of all, I'm going to be selfish and keep them to myself and say, Dr. Shweta, please explain to us, what do we mean by automation? It's in the media all the time, but let's dispel the myths. Exactly what are we talking about here? And then I'm going to bring in my next 2 speakers and ask you also to set the scene for us.
Is it working?
Yes.
All right. You know, I'm speaking on automation and I can't even figure out the mic, but I'll try my best.
Between us, we can do.
So if you look at automation, it's basically one of the biggest breakthrough which we've had in lab medicine. And what it does is you can take different analyzers which perform different tests, different specimen types, and you can integrate them together, put them on an assembly line, and different specimens go to the different analyzers, and they are run with minimum human intervention. And again, automation is not only hardware, it's also the software, which is the middleware. And I always say, it's like if you buy a Porsche, but you have the middleware of a moped, it's not going to work. So automation is both the hardware and the middleware, and that's what defines automation in laboratory medicine.
Fantastic. So we're minimizing human intervention. And as you said, that the words, it's not just hardware, it's also middleware. Okay, fantastic. Dr. Andrew, if I can bring you in now.
Yeah, I mean, for sure, over the last 20 years or so, we've seen this completely revolutionize the way we do our jobs. We're able to produce enormously larger numbers of results much faster, much more accurately, with far less resources. So it's really, you know, in the same way automation is extensively used in manufacturing, you know, we're a little bit like a manufacturing industry. We produce laboratory results and we're able to produce them faster, more accurately and cheaper.
And I think that's a really fascinating point you make there, that this is actually happening in many other industries. But when it comes to this particular industry, then there is an acute pressure to automate. But what does it also mean, and what are some of the benefits? Dr. Layla, if you can explore this issue of what do we mean by automation in application in this context?
Yes, automation to me means precision and reproducibility and also quality of results. So by enabling technology, we can also enhance consistency in the performance, so then you get the same output. It's also about speed, as Andrew said, about scalability as well, so you're able to put out lots of results in a very short time, but also lots of accurate results in a consistent manner. So time to decision is very important for our clinical colleagues who are obviously waiting for the results to treat and act on the treatment of patients. So speed is really important, but also equally important are reproducible, accurate results. And to me, this is what automation is all about.
And I really appreciate you emphasizing that speed is important, yes, but also accuracy of results. So let's expand on this point. Dr. Shweta, if I can bring you in again. So we've talked about what is automation and the need for automation, but what are some of the challenges and the barriers?
I think one of the biggest barriers, I think, is for the people to understand what automation is. And if you just walk around and you ask people what automation is, the first thought which comes into their mind is, oh, we want to reduce our manpower, we want to cut our manpower. And that is a mindset, is the first barrier where we don't want automation, because the first thing they feel is a loss of jobs. So, our job here is to explain there is beyond optimization what automation does. So another challenge what I feel is, other than understanding, is the cost of automation. So the benefits of automation, the return on investment is long-term. There are short-term returns and there are long-term returns. So many times it is very difficult for the management to understand what are the long-term returns on it, and they make short-term decisions and do not think long-term. So financial is one of the challenges which I would say. The second challenge is, of course, is never having done automation. So we come from a generation where most people haven't done automation. They're very skeptical about it, and they don't know what to do. So understanding the roadmap, also understanding automation is total lab automation. There is also a partial lab automation. So you don't have to go total lab automation. You can also go on a partial lab automation. So the biggest challenge is, do you understand your lab? So if you need a partial solution and you go for a total lab solution, it's not going to have the desired effect. The automation will fail. So biggest challenges for the people making the decision is to understand what are your bottlenecks, make a roadmap, and understand how much automation is needed. The third challenge is, of course, is the learning curve. Again, we are generation Z and X and everything, so X, Y, Zs are all together. There are some of them who are very good in understanding the middleware and are very keen to learn, and then we have generations like mine who are a bit wary, and change is something which people don't like. So the ability to take everybody along and make them comfortable is imperative for automation. And one of the other challenges which I feel which is loss of skills. So the way we look at it is, we are automating molecular, we are automating genetics, we are automating everything. Are we losing key skill sets? Is our psychological dependence on automation so much that we've lost the ability to critically think? We do not know, once the automation fails, are we able to then go and pick up from where we started? And I think that's human nature, is, if you have these cars, driverless cars, it's good for old people who don't drive, but what about the younger generation who will lose the skill to be able to drive? So of course, automation has its own challenges. And the last challenge, which I would say is one of the biggest, is the middleware, the software, is if you don't understand IT and you don't understand the ability of the middleware to integrate and use it to your full potential and set up the algorithms and make sure you're able to pick up glitches in the technology because it's doing what it's supposed to do, then it's one of the biggest challenges in automation.
Thank you so much, Dr. Shweta, for that very comprehensive answer in terms of the challenges and the barriers. And I really appreciated you saying there, in particular, as you outlined many of the different points, it's about this learning curve of taking everyone along with you. And I think that's where panel discussions like this are so vital, because we're trying to ensure that our audience and more of the general population understand the nature of this, and we bring them along with us. I'm going to come to you in a moment, Dr. Andrew, about the nature of automation and the role of technology. But first of all, Dr. Leila, if I may expand on something that Dr. Shweta mentioned there, it would be wonderful to hear your issues in terms of job displacement. Dr. Shweta was astute in pointing out there are a lot of fear about job losses. So how can we address this head on?
Yeah, absolutely. I think obviously with automation there is a huge improvement in efficiency. which means we can do a lot more with less manpower. However, our experiences have always been that we are able to upskill that workforce, so then they are actually concentrating on other neat and wonderful tests and technologies that we need, more efforts to. So we leverage the introduction of automation so we can free the scientific capital that we have in the laboratory to actually then develop more sophisticated tests. So when we introduced automation, our send-out test dropped dramatically down because we were able then to invest in other more complex technologies and introduce more complex laboratory tests. So involve that scientific mind in kind of a more complex operations. So no, I don't think automation is a threat. Automation is a huge opportunity. You upskill your workforce and you redeploy them in doing actually other more interesting and much needed services for our patients, rather than waste their times in doing things that we can potentially automate.
I think that's a really empowering message. I'm just going to emphasize, Dr. Layla, there, just really saying how automation is not a threat, and actually you can leverage this type of technology to upscale and free up time as well. And Dr. Schrader, I'm going to bring you in just a moment, but just this emphasis on this point, because often technology is still thought of as a threat. So I think it's worth double underlining that point. And we've heard from other doctors here on this stage during the M42 main stage here for the last 3 days, speaking directly about their frontline experience being improved because technology has freed them up to do the work that they actually want to do. So again, I think that point is really important. Dr. Shweta, you've been very patient. Please come in now.
No, I mean, and I think everybody is aware that we do have an acute shortage of skilled staff. So many places, it does then compensate for the attrition and the shortage. And nowhere has automation played such an important role than, I would say, during the pandemic. If we did not have automation, we couldn't be able to churn out results the way we were expected. And our processes were automated, and we got better and better as the pandemic progressed.
Absolutely, and you're right to point out that we've all been through this global experience which has changed the way that we've had to think in a way that's been uncontrollable. Dr. Andrew, you've been very patient there, waiting at the end as we've been monopolizing the stage, us women here. Let's go back to what Dr. Shweta mentioned, automation and the nature of AI and technology. Talk us through this. When we talk about the role that AI plays in automating decision-making within laboratory medicine.
Okay, I mean, this is something that's been evolving steadily over the recent years because obviously the amount of computing power that's available has gone up exponentially. And so if we go back a few years, a lot of the workflow decisions in the laboratory depended on programs that were basically inside the technologists' heads. Then those decisions moved to the laboratory information systems. And then I think more recently still, we're able to feed more and more information into those systems so the decisions become more sophisticated. An example would be we'll run what we call a blood count routinely in a hematology laboratory. A percentage of those will be abnormal, and then it's common practice to look at the blood down the microscope. Historically, a relatively simple algorithm would be used to decide what ones got looked at, and a lot of them didn't really need to be looked at. It didn't add any useful information. These days, though, we have middleware that's sophisticated enough to actually know the patient's history, the diagnosis, even things like it'll look at the location where the patient was admitted, and it will see a pre-op location. It'll see this blood count's come 2 days later from a post-operative location. It'll infer the patient's had an operation. There are certain abnormalities that are expected after a traumatic event that you won't get any extra information by looking at a microscope, so it won't order the test. So we see things are getting more and more sophisticated all the time, and that's at a sort of relatively simple algorithm level. And then when you take it to the next level, we now have computers doing things which historically we thought could only be done by human beings. And probably the best example of that is image recognition. So, for example, we now have machines in the laboratory which are connected to a microscope, which will scan blood film slides, identify all the white cells of interest, and then classify them. So historically, someone would sit with a microscope, find all the cells of interest, and make a decision on what they are. Now that person sits at a computer screen, they have all the cells pre-categorized for them, and they're just checking that they agree with the computer's assessment of the situation.
And that example that you share there, Dr. Andrew, that sounds like one of the very key examples, as Dr. Layla saying, about efficiency and speed and reducing maybe some of the kind of the slog in order to free up the scientific minds.
Absolutely. I think what we're seeing really, I mean, the key phrase that's used a lot is decision support or diagnosis support. So we're seeing not that the people are being removed from the system, but that a lot of the kind of donkey work is being done by a machine, and the bit that really requires human involvement and a final decision is then the bit that they're involved on. I mean, just this morning we were actually looking at some examples from digital pathology for a study that's about to start at Cleveland Clinic, where they're looking at slides from patients with prostate cancer, and essentially the computer system is taking a digital scan of the slide, identifying all the areas of potential malignancy in the slide, highlighting them and scoring them. So instead of the pathologist having to scan the entire slide and start from scratch, it's like it's been triaged for them. So the machine has already gone through, identified areas of interest, and they can focus their attention on that. It's also said there are 15 slides on this patient, and 8 of them don't contain any malignant material. So you know, instead of having to look at 15 slides, now you've only got to look at the ones that actually contain something of interest and classify it. So I think it's starting to really revolutionize the way we work.
And I think those examples that you share are super powerful because they're real life examples, as you said, just from this morning. So this is breaking news. So it's very interesting to hear this. And we're not just talking about reducing hours of work, we're talking about days of work being reduced. So that's a lot of people power that's being freed up.
I mean, yeah, absolutely. It's taking some of your most highly skilled, trained individuals and making them much, much more productive, because they can go through, you know, a lot. First of all, with the first example I gave, there's less material to look at because, say, there's less slides because they've already been triaged. You're only looking at the ones that are relevant, and the ones you are looking at, the relevant sections of those has already been identified. So you have a very good idea. I mean, there's obviously a risk as well that it introduces a bias or it introduces someone to be too casual with the review. But overall, I think it's more than balanced out by the fact that instead of spending, you know, hours every day down the microscope, now that job can be reduced to far less time, and a lot of it can be done sort of sitting back comfortably in a chair looking at a computer screen.
I think that's really exciting. So thank you so much for sharing those examples. Now, Dr. Layla, if I may begin with you, and I'm going to open it up to my panelists as well. In terms of speaking about these examples that can be shared and role models across the world that we can learn from here in the UAE and across the Middle East, how important are other test cases and also the power of collaboration when it comes to industry stakeholders and researchers and the healthcare industry?
Very good question, I would say. Definitely, I mean, the power of collaboration became very, very clear during, again, the COVID pandemic, when healthcare alone couldn't take it, yeah? So you have to have pharma, you have to have the engineers, you have to have, you know, the logistics industry, you have to have everybody supporting. And I think the academic institution, the research, everybody came together to kind of try to solve this problem. And I think it was a very powerful lesson for us that we learned the power of collaboration, yeah? We don't have to bear the brunt. So a lot of what Andrew was talking about really is devised by engineers who are able to write algorithms, who are very clever in mathematics. Yeah, you know, we know biology very good, but perhaps not math. God forbid, the algorithms, you know, writing algorithms. But if it weren't for these engineers writing for us, or at least knowing the language, we are supposed, to write, we won't be able to leverage the technology. So definitely collaboration is key with all sectors of the industry. We are the National Reference Lab at a very privileged situation because we have also collaboration, I would say, with the two giants in the United States. So we value our relationship and links with the Cleveland Clinic in Ohio. We also value our relationship with the Lab Corporation in the United States. These are two big players in healthcare and in laboratory medicine in general. And we leverage this by sharing advancements, innovations, any new novelties that comes into the field and leverage this. We're also, to Andrew's earlier discussion, we, through digital pathology now, we're able to digitize slides and then share them with our colleagues at the Cleveland Clinic. So the slides are scanned, they're sent, let's say we need a head and neck pathology expert to look at this. We scan them, we send them to our colleague who's a head and neck expert and say, hey, James, what do you think? I mean, and we get a reply within hours. So again, imagine in the old days, and if we didn't have this technology, these slides would have to be shipped, sent by secure mail to be received, opened, and somebody act on it. We get the results back within a couple of hours. Yeah. So again, speed to decision. That surgeon who's waiting to know what to do for the patients and so on. So I mean, this is just one example of how we leverage the collaboration and relationships with those wonderful institutions that we work with. But there are many more. But excellent question. Thank you.
And it's a really powerful example as well because it illustrates from start to end how the automation process can be of benefit. Now I'm going to ensure that my audience is welcome to ask questions of our illustrious panelists. We've still got a few minutes on the clock. Please do indicate. Don't be shy. I can come back to you because I have many more questions to ask as well. Dr. Leila, as you emphasize there, building on what Dr. Shweta and Dr. Andrew point out, it seems clear, it's a no-brainer that this is the way forward. Dr. Shweta emphasized the pandemic really was the way to speed up us embracing this. But also I've heard that from you all, and we know in the narrative out there, there is still a fear to embrace technology in many places of the workforce. You mentioned earlier a generational shift. It's a cultural shift as well, isn't it? When it comes to the UAE and the Middle East, how do you all see them embracing new technology? Are they more open-minded than elsewhere in the world? It's interesting for us to explore this. Dr. Leila, may I begin with you and then come through?
Yeah, absolutely. I think we're very fortunate because I see, UAE is a very progressive country. And they embrace innovation. They like nifty things, yeah? So I definitely, and they get excited about these advancements. So I think we're in a very good place because of the nature of our leadership and how they really encourage and embrace these initiatives. As far as the workforce is concerned, as I think Dr. Shweta indicated, there is variation, and that depends on the age group of the people, yeah, working in the workforce. But definitely, the younger generation, Generation Z or Z, these people are very fast with embracing the tech. In fact, they love it. That we worry a little bit about them because, as Andrew said, we worry about them losing the skills, yeah, the technical skills. We're so reliant now on technology. Now the older guys, Generation X and so on, they still kind of, some of them are skeptical, but some of them also embrace it. So there is a bit of variation there. But overall, once you get a critical mass of your workforce embracing this, then the reluctant few will ultimately join. So you always have the early adopters, and these usually are the younger guys, and then followed by those who love technology and so on, and then ultimately the rest will follow. And we've seen that in all of our initiatives that we've done at the NRL.
I think that's really interesting to hear that perspective. And Dr. Shweta as well, your insight in terms of comparing where the UAE stands when it comes to the international model on this.
So adoption to any automation is, there are two aspects to it. One is the organization. So in UAE, the organizations are always at the forefront of introducing what's needed for patient care, what's needed for quality, whether it be technology, whether it be processes, whether they're ready to take that cost, whether their due diligence. So we've never had an issue in introducing something. So that is always taken care of. To the second aspect, the human. Humans are humans, whichever part of the world you go. Those inherent fears are a part of our DNA. So loss of job is an inherent fear to anybody, and anybody sitting here will relate to it. So whether you are in UAE or you are in India or you are in US, that's something which is inherent. And the same sensitivity needs to be used to all of them, of course, the older people a bit more maybe, but the same sensitivity and the same education and the same approach should be needed. And I think we should be patient to give them enough time to accept it. And my learning is take them along when you make that decision. If you don't take them along when you make that decision, they will not be along when you've made that decision.
I think that's a very powerful point. And as you say, it is universal, this fear. One of my other panelists earlier said it's human nature to resist change. So again, that's a very universal trait that we are dealing with, but taking them along could be the key to that. Dr. Andrew, your insight in terms of what we can learn internationally when it comes to best practice.
I think we're in a very fortunate environment here because, we do really have access to some of the best technology in the world, and we're able to collaborate with some very leading companies. So I think from that perspective, as Leila said, the UAE has been particularly sort of forward-looking, and as a very young nation, I think it readily embraces change perhaps more so than other cultures. And I think we see that in our workforce. As Leila said, it's easier perhaps for the younger generation because for them change has become the norm. And so I'd say overall we haven't had really too much trouble with our workforce adopting. We've automated a lot, we've changed a lot of processes, and I think generally now for the most part people accept this is going to be for the better. I think they're quite sure there is always that fear in the back of people's heads that we're going to automate something and they'll be out of a job. But I think for the most part they've seen that hasn't really happened. What we see is every year new biomarkers become available, new technology starts to move into the clinical space and out of the research space. And as that happens, it gets adopted in the clinical laboratories and it creates, different roles for people. So some of our staff have been with us a long time and have, had several different roles over that time, but they're still there. So I think, generally people are more and more receptive to change as time goes on.
I think that's a very positive perspective there, and you're absolutely right to emphasize the UAE. It can be seen as quite unique, actually, and I've seen in my experience here in the last decade, and also when speaking about subjects like this, we often talk about what we can learn from the international model, but I think there's a lot more that's happening here in the UAE that we can export. That the world is actually looking at what's being done here at the forefront of technology. And of course with M42 at the nexus of technology, sustainability and health, as we've been celebrating. We've only got a minute or so on the clock. I'm just going to check, are any other audience members keen to ask a question? That's okay. Our panelists are super approachable. Please do grab them, invite them for a coffee at our coffee bar afterwards. You might have a question that you'd like to put to them. Let's end by looking to the future. This area in itself, automation, is very futuristic. But we've talked about some of the barriers, the challenges, we've talked about what's being done now. Let's do a little bit of future gazing.
So it's a different kind of technology. We're now in a position where some of the routine tests that not so long ago required a large analyzer in a hospital set laboratory can now be run on a small handheld device. So we're starting to look at this idea of going out into the community, collecting samples that need to be brought back to the lab, but also providing on-spot testing and feeding that information back into the computer systems and having the physicians online evaluate it. So I think this is quite an exciting development which could start to revolutionize healthcare.
Absolutely, that's very exciting. Dr. Shweta, can you top that?
Yeah, I agree with Andrew. I think, the way the future is going, sustainability, a smaller carbon footprint, getting quicker results, the results where the patients don't have to commute so much. So I think that is where we are going to see the automation happening, integration of the results back into the lab information system remotely. So I think that's the future.
Very interesting, thank you. And Dr. Layla,
I see a paradigm shift. In fact, it is already happening. Yeah, from I would call it now. We will start practicing medicine. I was just sharing that with my colleagues. 3.0. So we're in medicine 2.0 now, where we wait for patients to be patients. Yeah, we wait for people to develop disease. We diagnose them very accurately and we treat. Yeah, very very soon. In fact, happening now. We are able to predict who is going to run into trouble, save it, prevent it, rewind the clock, don't wait for them to develop the disease and interfere. So that's medicine 3.0 to you. And I think it is with all these predictive algorithms, with all these intelligence that a layer of intelligence that we apply on healthcare and this whole paradigm shift in the way we approach medicine, we are going to be doing that.
I think that's a really powerful point to end on. I love that title, Medicine 3.0. That's going to be the next panel discussion. I want to be on stage with all three of you again, and we have that title. And Dr. Layla, as well as Dr. Shweta and Dr. Andrew, you astutely tie into the key messaging for M42. There on our back screen there, we've got people, not just patients. And it's this idea of prevention, ensuring that we actually intervene earlier. Technology is the way forward. But to hear about it from the laboratory setting in particular, this has been super illuminating for myself. I hope it has been for you all. Please do give my panelists a big, big round of applause. Dr. Shweta, Dr. Andrew, and Dr. Layla.